Hello, my name is Marisol, and today I'm going to be demonstrating the intradermal injection. So first things first, I'm going to name the first 6 rights of the medication administration. It's going to be the right patient, right dose, right time, right route, right documentation, and right dose, right medication, right time, right patient, right dose, right route, and right documentation, right? Okay, so first things first, I'm gonna collect all of my supplies, and this is gonna be the first time that I check my order. My order reads tuberculin skin test, 5 tuberculin units per 0.1 ml intradermal once. I'm gonna make sure that I get the correct syringe and needle. So the correct needle for this procedure would be a 1 ml 25-27 gauge and 5/8 inches. And then the medication is tuberculin purified protein derivative. I'm going to make sure that I have the correct medication. That's one from the electronic medical health record, EMR. I'm going to make sure that I have 2 alcohol prep pads, one for the skin and then one for the lid of the medication. This is empty. And then I also have a cotton swab and some gloves. So I'm gonna make sure I have everything. Okay, so now that I've collected my supplies, I'm gonna go into the room, knock knock, close the door for patient privacy. I'm gonna go ahead and let the patient know my name. Hi, my name is Mari. Today I'm gonna be a nurse and I'm gonna be giving you the TB test. Do you mind telling me your first name and your last name and your date of birth? Okay, perfect. Thank you, Ms. Tupo. Okay, so I'm gonna go ahead and check the patient's wristband, see if they have any allergy, see if I have the correct patient, and see if they have an allergy wristband. Patient does not have an allergy wristband, but I'm also gonna ask the patient, do you have any allergies that I need to know of, Ms. Tupo? No? Okay, perfect. Have you ever had a TB test done before? No? Okay, so basically a TB test is, I'm going to be injecting some medication into your forearm that is going to be testing to see if you have a reaction to TB. There are some common side effects like redness and swelling or itching and irritation. When I get the TB test for work, I get some itchiness. When I do inject it, you will feel a slight burning and slight stinging sensation. But if you start to feel like excess swelling or if you have a large lump that's causing you severe pain, you need to let someone know right away, okay? Perfect. So I'm gonna go ahead and check the medication one more time inside the patient's health record. Okay, I have the correct medication. So I'm gonna go ahead and hand hygiene. Hand hygiene when I first come into the room too. Gonna get some gloves after hand hygiene. It's my first time using it, so I'm gonna go ahead and take this cap off. I'm gonna open up an alcohol prep pad. I'm going to wipe it. Okay. I'm gonna go ahead and open up my syringe and needle. I'm going to discard of it, but due to possible radiation, I'm going to go ahead and keep it. So first things first, I'm going to hold up the syringe like a pencil. Make sure that I read the order correctly. It's 0.1, so I'm just going to go ahead and pull down some air up until 0.1. I'm going to uncap. I'm going to leave the cap close nearby because I will be recapping. I'm going to go ahead and inject. Gonna go ahead and invert. Okay. Go ahead and flip this over. Gonna go ahead and take it out. And I'm going ahead to recap. I'm going to do the scoop method, which is by putting it in that. Okay. And then pushing down from the sides. And this is 0.1. Okay. So now that I have that done, I'm going to put that out of the way. Okay. So Ms. Tupo, I have to inject it on your forearm. Your forearm is going to be from your antecubital space, 3 fingers below your antecubital space, and then 4 fingers from above your wrist. So I'm gonna go ahead and also check your skin to see if there's any swelling, edema, redness, basically scarring that to make it not allow me to give you the injection. So I'm gonna go ahead and feel for that, Okay. All good to go. In case that there was something like that, I would try to do the other arm. So now I'm gonna go ahead and do another alcohol prep pad. I found my spot. I'm gonna clean it outwards and discard of that. So now I'm gonna go ahead and let that dry without me swishing or anything. And this will be the last time I check the medication. Okay, I have the correct medication. Alright, so the next thing that I'm going to do is inject the medication. Okay, remember you will feel a slight burning. Just go ahead and let me know how your day has been. And for this, I'm going to go ahead and take off the cap. And I'm also going to hold her skin taut. And then I'm going to make sure I hold the needle at a 5 to 15 degree angle. And I'm also going to make sure the bevel is up, which it is. I'm going to insert. Perfect. I don't need to insert all the way, just enough to make sure that the bevel is all the way in. And then I'm going to inject. Okay, perfect. All right, and then because this is a safety needle, I'm gonna go ahead and push it up. Perfect, and I'm gonna discard of that into a sharps container. Okay, now that I see that there is a bevel, that's perfect. And then I'm also going to make sure that if there's any blood to just dab it, because with a TB test, you don't want to rub the patient's skin because we do need the bevel for the test. The patient will be returning in 48 to 72 hours to see if they are negative or positive. And then I'm going to ask the patient if they're okay. Are you comfortable in doing okay? Perfect. Okay, I'm going to go ahead and clean up all my supplies. I am going to take off my gloves, discard of that, hand hygiene, and document the procedure.